Lila Lazarus. In the history of medicine, there's never been a health disaster quite like this one. All over the U.S., people with joint and back pain were injected with a contaminated steroid that came from a compounding pharmacy in Massachusetts. That steroid was supposed to relieve their pain. Doses of this tainted drug were injected into 14,000 patients in 22 states. Some 500 people are already sick with an unknown fungal meningitis, a black mold inside their bodies. It isn't contagious, but it can be deadly. Nearly 40 people have died since September. Tennessee was hit hard, so was Indiana, but Michigan has been hit the hardest, with more than 130 people infected. Doctors, even the Centers for Disease Control, have never dealt with anything quite like this before. This story is still unfolding, but leading the way in the fight to save these patients' lives is a hospital right here in Michigan.
So we're going to pop some fluids up. We're going to get you something for your headache, okay, and give you something for nausea, okay, and get you feeling a little bit better whilst we're going to do this, okay?
We still have patients that are coming in that have just now been experiencing their symptoms after their injection. We have a patient here now today for her first visit that will probably need to be evaluated and potentially have an LP for her diagnosis.
Lumbar puncture.
Yes.
And I'll draw the blood out if you would let us, and we'll just go that route. You allergic to anything at all? But if they come in and they've got symptoms at all, we're performing a lumbar puncture to make sure that we don't miss meningitis, because it's such a devastating illness to miss. Patients can come in with headaches, nausea, vomiting, fevers. They don't necessarily present like a classic meningitis.
Deborah Zegda is a mother of two from Whitmore Lake, one of the hundreds of patients who have flooded the emergency rooms at St. Joseph Mercy Health System since September. Patients who received tainted steroid injections for pain at various pain clinics in Michigan and now fear the worst.
I'm nervous, I'm upset over it. I mean, it's, you know, when you can die over something like that, it's just, you know, really scary.
She has a headache. She recently had an epidural injection, concerned about the possibility of meningitis, and so we're going to evaluate her for that by doing a lumbar puncture.
Why were you getting the injections?
I have a lot of pain in my back. It's like when I walk, anything, it's really severe.
In the last 2 months, more lumbar punctures or spinal taps have been performed at St. Joseph Mercy Health System than they would usually do in a year.
You doing okay? Okay.
It's a little scary thinking that your mother could be infected with the fungal meningitis.
This hospital has become the epicenter of the nation's meningitis outbreak. St. Joe's is treating more of these fungal meningitis patients than any other facility in the country.
It has affected us on a daily basis. There are so many people. I think the emotional side is a little bit harder. They're scared.
In a lot of ways, this was like responding to a natural disaster. It was clear to everybody that this was not something we were used to dealing with.
We have to make sure that they're not waiting too long. These are scared, fearful patients that are coming here to find out if they have this fungal meningitis.
This is the morphine going in now, and I'll go grab the supplies. I just got a little bit more to go here.
She's the world to me.
We've seen a lot more patients than we normally would, and we're doing a lot of lumbar punctures on these patients. So.
They come in, you know, afraid, and the last thing that I want them is to have hours of a delay to try to find that diagnosis.
It's scary, very scary. You know, you don't know what's going to happen. The unknowns, you don't know what unknowns are.
The unknowns. It's what doctors, nurses, pharmacists, the administration, everyone at St. Joe has been dealing with since September. Back then, it seemed like just a half dozen patients with similar symptoms.
We were noticing a group of patients that presented with what appeared to be a bacterial meningitis, except that it didn't quite fit.
Infectious disease expert Dr. Varsha Mudgal. She's the one who had that first clinical hunch they were dealing with a major public health disaster.
Dr. Mudgal, the infectious disease physician on this campus, put it together very quickly and knew that this was a unique group of patients.
It was Mudgal who started to put the pieces together, that Southeast Michigan had an epidemic of fungal meningitis.
It was like a light bulb went off. Every one of the patients that I had on that list had received the epidural steroid injection. Oh my God, everything now makes sense.
She calls me up on the phone and she says all 5 of them have had injections. And I could just feel the hair on the back of my neck standing up. It's one of those moments where you think, oh, this is real. How many patients are there? How many are going to die? What can we do for them? We knew there was something in that solution causing meningitis.
Infectious disease experts and pathologists at St. Joe went to work.
I get a call from one of these young women, and they said, we've got a fungus growing. I come and look at it, and I thought, oh, no, it's one of these cases. 3 days later, one of our plates starts growing a fungus. I actually have a picture of it. It's very scary. We don't normally see fungal meningitis. Okay, so let me show you something.
What pathologist Paul Valenstein wanted to show me is the very fungus growing in these patients' bodies.
This is the fungus. It's growing in a plate of agar.
How long has this been growing?
This one's been growing about a week.
Does it grow this quickly inside the body?
No, it grows slower in the body.
To see this many cases of fungal meningitis, what did you think?
Oh, I never thought we'd see this many. You just don't see this disease. This disease didn't really exist before. Nobody injects fungus into somebody. I mean, it's just not a naturally occurring disease.
These patients weren't cared for in a St. Joe's facility, and we could have taken a very passive approach, which is, well, if they present here, we'll do the best we can. But when we look at our reason for existing as St. Joe's Health System, it's to serve our communities. It's to break down walls and barriers and to improve the health status of everyone who comes to us. So in my view, this is a moral obligation for us to reach out, to identify patients who've had this unfortunate set of circumstances and to help them the best way that we can.
St. Joe did reach out, proactively getting the information out so patients who received the injections knew the symptoms to look for and where to go for help. Terrified patients flooded the emergency rooms, first at St. Joe Brighton. How did you first hear that you had a problem?
I got this text that said Brighton ER will be receiving up to 600 patients.
600?
600 patients, and I didn't believe it. Then we realized actually with the disaster that was occurring that we could get up to 600 patients. We immediately knew that we had to call an internal disaster and plan our next steps.
We got hit hard, we got hit fast.
We don't know what we're dealing with, and I think that's the scary piece of it. And we don't know how many patients are going to come, and are we ready to handle that influx of patients? Our emergency department here only has 13 beds.
But on St. Joe's side, the massive resources of one of the region's largest health systems.
What kind of symptoms are you having? Neck pain? Okay. Have you had an injection? Okay, let me get a triage nurse for you.
Well, we have a spectrum here that was completely new to us. We had patients who looked mildly ill to patients who were fulminantly ill. The volume of these patients with these meningitis symptoms was a totally different number. So we probably did about 50 spinal taps in that weekend. And normally we do about 1 or 2 every 3 or 4 days.
We had to make sure that everybody was on board and available 24 hours a day. So it was just unbelievable how the team came together.
All of us had seen 1 or 2 cases in our career, perhaps in training, and everybody had read about it. But in terms of seeing it on this scope, something none of us could have ever imagined.
It's a very rare fungus that's really not been well described in terms of causing infections in humans. There's been some eye infections and some sinus infections, but nothing ever like this.
What had started as a handful of patients was doubling and tripling fast.
All of a sudden, we had 40 patients in the hospital that we weren't expecting to be in the hospital. We're staffed for usually around 220 patients for my service, and all of a sudden we have 260.
Very quickly, within about a 10-day period of time, that number went from 6 to over 60. And now we are the epicenter of this outbreak, with having the most patients with this infection being treated here at St. Joe's Ann Arbor.
Patients who tested positive were immediately placed on powerful antifungal medications, but those medications are in short supply.
These drugs have probably never been used in such large amounts in such small cohort of population in such a small amount of time.
Unfortunately, the drugs that are available have significant side effects.
The first one, called ambisome, is very toxic to the kidneys. Very difficult to dose. Once it attacks the kidneys, there's nothing you can do. A lot of people start to go into kidney failure. The other one, voriconazole, attacks not only the kidneys, the liver, can have effects on the heart. A list of drug interactions as long as you can think of.
And now, in high demand, these drugs have a very high price tag.
This is $150 a vial. This is our contracted price.
And how many vials does a patient need?
A patient could use up to about 10 to 15 vials at a time. This is probably about a 10-day supply for patients. The cost of this is much more than what a brand new car would cost today. So it just gives you a good comparison of how much money that these drugs are.
They're being told that it's perhaps $8,000 a month. absolute sense of sticker shock.
How are they paying for this?
A lot of patients are worried about it. A lot of them are saying, I don't know how I'm going to afford this. I don't have that kind of money laying around. The only thing I can do is tell them that we'll figure this out together.
I talked to one patient personally who looked at me and he said, I'm really afraid of leaving the hospital. And I said, I know it's a scary disease, but you're going to be okay. He goes, oh, no. It has nothing to do with the disease. I can't afford to leave here. This drug is so expensive. I can't afford to pay for it. And I kind of looked at it and I said, my gosh, this is beyond what it's costing in a hospital. This is down to individuals who are going to be both out of their lives for a while, but also, worried about it destroying them financially.
Who's going to pay for that medication?
Right now, we are providing an enormous amount of medication to these patients at our cost. And we're also wiring them into assistance programs. Even the drug company has them. At the end of the day, I don't know who's going to pay it. I think a lot of it will be borne by us. We hope to get paid for some of what we do. But really, I'm not sure. It could just be a loss for a lot of people.
This is a disease that's never been described before, a disease that's never been seen before. I'm not sure that there's ever been an outbreak of this much magnitude. It's unprecedented.
Once they solved the mystery of where this illness was coming from, then came the onslaught of questions.
A lot of questions are unanswered.
How big was it going to be? How many people would we need to mobilize?
Where are we with medication procurement? Do we have enough for all of our patients?
How long would it go on?
How is social work reaching out to these patients?
And we had no ability to know.
What do I need to do? How do I deploy resources to support the nurses and the physicians?
Do we have enough beds? Where do we put them? Where do we do the procedures? How do we get them processed?
How do you dispense these medications? What medications, what doses do you dispense them in? How do you procure these medications?
This is not like responding to something that it's cookbook and algorithmic. It's something that every day it's a little bit different.
As major questions are answered, more follow. Mostly because the patients are changing. It isn't just meningitis symptoms anymore. Patients now come in with an abscess, pain, infection at the site of the initial tainted injection.
No one really knew, and no one still really knows how are these people going to respond. Everyone is on therapy, but how long therapy is going to be defined for, when people should get repeat spinal taps, when people should get MRIs, a lot of this is still unclear and unanswered.
I have never faced a situation where patients who are otherwise generally healthy develop fungal meningitis.
Lakshmi Halashamani is St. Joe's chief medical officer.
The sense of uncertainty allowed folks to say, well, we're going to have to go down this road together. Let's figure out how we each bring our strengths to the table and create a path that brings value to our community. Although there's a lot of uncertainty, it's better to be in the dark with lots of people with flashlights than to be in the dark by yourself. So I think we're bringing in as many folks as we can with flashlights so we can all sort of forge this path together.
From the moment the St. Joe team knew what they were facing, it was all hands on deck.
You mobilize when you know that people's lives are in your hands.
It was one-on-one phone calls to people's houses and the doc saying, can you come in? We had docs that we called who lived 20 minutes away who were in the emergency room within 40 minutes of the time we called.
Every person we reached out to, their only answer or question was, what can I do to help?
I called on this Monday afternoon to say, I'm looking at, 110 patients in my emergency department. We have 64 beds, so you can kind of do the math to figure out what was going on. And I said, there's no way we can do this single-handedly as an emergency department. We're doing the best we can, but we're getting behind, and we're going to need some help. So yeah, I picked up the phone, and we have a process to alert, the disaster. And when I did that, and I'm on the phone, I just turned around, I have a tap on my shoulder, and there's the chief of staff standing behind me. There's the chief of anesthesia behind me. There's one of my colleague managers from PACU's behind me. They didn't get on the phone, they were in my department, and that's just like awe-inspiring. We just went for a week straight, 24 hours of care and places to take care of these patients, and it was amazing, so that there wasn't delays.
As far as lumbar punctures go, this has to be the most you've done ever in this short amount of time.
Absolutely. I would say on a daily basis we may do 1 or 2 a day. We did up to 60, I think, on one day. So, and these lumbar punctures are a little different than what we would normally do. So these patients needed more fluid collected than we normally do, and so the amount of time that we spent doing the procedures was at least double.
How you doing, Deborah?
Okay, just a little tired.
How long will it take till she has a result?
About 45 minutes. We get a result back in half an hour to 45 minutes. In the meantime, we're going to give her some fluids and hopefully getting her headache feeling a little bit better.
But even if she goes home, Deborah's not out of the woods. When we come back, the emotional struggle of the patients and the people fighting to save their lives.
I have a patient out front that's had an injection, that's having severe neck pain.
Every day since the end of September, more infected patients have arrived at St. Joe, now more than 100.
Deborah, can you verify your birthday for me?
Some for the first time.
We're going to lie you down. We're going to give you a little bit of fluid, okay?
Some returning in even more pain.
Don't be John Wayne. If you need it, let me know. It's no big deal.
Across the country, the death toll has been rising. 10, then 20, then 30, and so many lives impacted. In nearly 50 years of marriage, Christine and Spike Walker had never spent one night apart.
We're just kind of joined at the hip, I guess, a little bit. So.
Until this happened.
Something was disturbing my body, I could tell. We got an ambulance, they got me in.
Spike Walker is one of those patients who at first tested negative and returned home.
I got home, I felt pretty good, and then I started to deteriorate again. They said, please call back. Please call back if you have a problem. So that's exactly what I did, and I got back in here.
An MRI showed a small pocket of infection. It was clear more and more of these patients, like Spike, were going to require surgery to scrape away the fungus.
Well, once we realized the scope of the problem, it was like, oh my God, how are we going to manage this?
Spine and orthopedic surgeons have gone into overdrive. More than 60 patients have been taken to the OR to drain abscesses along the spine.
Really, we were kind of operating in the unknown. We didn't know what the signs and symptoms of this fungus infection would mean in the joint. I did it arthroscopically, so I could actually see what was going on. So I took some samples and then really washed out and cleaned out the joint at that time.
How many years have you been a surgeon?
20 years, a little over 20 years.
In that 20 years, how many times have you done surgery to remove a fungus like this?
Only once in my life, and it was a total joint that had been previously infected. But these people are totally healthy getting a fungal infection. It's really no experience at all. Obviously, I'm afraid for them because, you know, they're afraid of this fungal infection. They're most afraid, however, of the ones given in the spine because people have meningitis, people have died from that. As far as the joints go, we don't anticipate that to happen. We think it'll stay local in the joint. We don't think it'll cause death or meningitis.
St. Joe immediately established a fungal outbreak clinic to manage patient follow-up and serve as a resource center. So right now, this is kind of ground zero.
It is for all the patients requiring follow-up or who have ongoing concerns.
Our experience here has really been able to help guide therapy for a lot of folks across the country.
Every day we have this wonderful 11 o'clock disaster call, the most amazing ID, pharmacy, wonderful minds are there and just sharing all the information every day that they have.
This issue is not going away. In fact, it's actually, we're going to see more and more of these cases.
The epidural cases, all the cultures are actually going positive or they're positive on stain.
Now, into the third month, no rest for the weary. Even after taking the powerful antifungal medications, some patients are getting worse.
This is a huge travesty for the patients, but it's also been for the clinicians. The physicians who administered these medications are just devastated by this.
Hi. Can we come in?
Rhonda Hall is a bus driver who'd been in an accident earlier this year and received shots for lower back pain.
The pain, it got kind of unbearable. I mean, really, it got really unbearable. I couldn't put any weight down on my left side.
A now familiar story. Her initial spinal tap came back negative, but the pain persisted, and an MRI showed an infection of the joint and bone.
Some of the joints lend themselves well to arthroscopy, in which case we get to look inside.
St. Joe surgeons went in and scraped the infection off the bone.
Your experiences may help guide therapy for others.
I don't want anybody to go through this. It's horrible. Horrible. And then I've got my husband, 30 years.
I was afraid for her, you know. It's been a long 2 weeks, you know. I love her so much, you know. And I was just hoping she was going to make it. She's my whole world. You know, I love her so much. And my 5 kids, you know, they're my world. And I can't lose her, you know. The doctors have been great here, you know, and the nurses and just everybody. They've made it a lot easier than what it could have been.
For doctors, it's the unknown that's so challenging.
It's not in a physician's lexicon to say, I don't know. But there's just so much that we don't know.
Patients are under a lot more stress that they came in trying to get better, and now they're not. They have this new illness, and I think that's the thing that causes me the most stress and makes me kind of lose sleep at night.
Patients are left with agonizing worries.
Am I going to be around to see grandkids or anything?
So St. Joe has set up a patient support group. It's got to be hard for you to see all these patients.
Go ahead and lie back for me, please, Rhonda, okay? It is. It's just you don't think this can happen. Obviously, we'll keep following you along and get you through this, okay? See, this many people have to go through this. It's really, really disappointing.
I will tell you, we've worked some exhausting hours around here, but everybody has, so I try not to complain.
Nurses from other St. Joe and even out-of-state Trinity Health hospitals were quickly issued emergency Michigan licenses so they could help with the crisis.
A lot of us have been here every single day. Hospital administration also has been here every single day and late into the night, helping us coordinate.
We're tired, our families miss us. I have a 6-year-old, and it's been the hardest probably on him. And I received an email from my child's first grade teacher, and she said, Mrs. Mouthgall, you're the last parent, the only one that hasn't signed up for parent-teacher conferences. And that's when I realized how disconnected my worlds had become.
All have been working round the clock.
It's been a complete team effort. There has not been one person or department that hasn't been touched, that hasn't pitched in.
When we come back.
Something tells me he means the world to you.
He does.
Anxious patients putting their faith and lives in the hands of the St. Joe medical team.
Thanks. That's what I say.
And is it meningitis or not? Deborah gets her answer. Or does she?
Hi, Dwayne. Hi. I'm Rob Castellou, CEO here at the hospital. I know you know Dr. Mouthgall.
At just 36,
So how are you? How you feeling?
Dwayne Hunter is used to pain.
The stenosis is so bad, I go in regularly and get injections.
He was one of the pain patients in Michigan to receive an injection from the tainted lot.
And I just kept getting worse. And then I got headaches that lasted for like a month straight.
Now he knows he's fighting for his life.
I'm just young. I got a son over here that I think the world of and wouldn't want to be without him. I just want to see him grow old.
45 minutes after her lumbar puncture, Deborah Zegda finds out if the test is negative or positive.
Well, the good news is that your lumbar puncture results are normal, okay?
Good. Deborah's going home, but isn't totally in the clear. The infection could still develop in the next few months.
We're not completely out of the woods, but it looks like everything is good today.
I'm glad I don't have it. That was the biggest scare. So.
But now it's a little bit of a waiting game.
It's always a waiting game.
If you feel worse, you come back and see us, okay? We're here 24/7 to be able to look after you.
It's wonderful relief, it's still a waiting game, like you said, it could take 2 more months, but as of right now, she's out of the clear, so that's always good. A lot less worrisome.
Yeah. So keep an eye on her.
I will. That is a promise.
We're writing the chapters in the textbooks about what this infection is about and how best to manage it.
Frankly, I think the world is watching us and learning from us.
We're building this bridge. Every time we take a step, we have to build another step in front of us as we go along this.
Knowing St. Joe has nationally taken a lead on this outbreak has been a source of strength for patients and their families.
That's great to have one of these hospitals around. I want her to be healthy and live to have her grandkids.
I was scared in the beginning, but now Dr. Milani and his whole team have just been awesome. Awesome.
It's not slowing down. It's probably not going to slow down for a while. And it's probably going to be like this for some time.
Just today, actually about 20 minutes ago, I got this slide, and here's another case. This is a epidural abscess, somebody that has a infection near their spine, but it's actually hasn't progressed to meningitis yet. And I can see the fungus in the slide.
It's not letting up.
Yeah.
We've had 6 patients coming in through the ER last night,
Yeah.
6 new.
We can't kill this fungus within a day or a week. We're going to be treating these patients for weeks and weeks.
As much as we think things like this would never happen, they do. And you have to be ready all the time.
Are you feeling better now with the headaches almost gone?
Yeah.
After almost a month of having daily headaches?
Yeah.
You have almost completely no headaches at
Yeah.
this time.
Yeah.
In the next day or so here, if he continues to improve like he has, we've begun to talk about discharge and going home.
Spike was among the first to be operated on. The infection in his back scraped away. He's so grateful to the doctors at St. Joe.
Thanks. That's what I say. I can only thank him for it.
He's the love of my life and always has been and always will be.
I think St. Joe as a system has done a phenomenal job. I'm glad to be part of this team, and we did a really good job in trying to contain this disaster.
It's a privilege to work as part of the team at St. Joe's. It's an absolute privilege.
Truly impressed by the quick response and the efficiency by which you handled this crisis. I'm very, very impressed, and I thank you.
I think in the future that St. Joseph's Mercy Hospital will be at the forefront of educating other institutions on the treatment, diagnosis, and follow-up for fungal meningitis or other fungal-related illnesses.
So if this happens again,
They're calling us.
as of today, some 80 patients remain hospitalized at St. Joe in Ann Arbor, and the numbers continue to climb. No one knows how long these patients will remain hospitalized, how long they'll have to be on the antifungal medications, or in the end, who will pay. The compounding company in Massachusetts, where this all began, has been shut down. The CDC keeps gathering information. The team at St. Joe continues to give their very best to these patients. Health leaders from around the country have been watching and praising St. Joe's decisive action as the team continues to face this unprecedented outbreak head on. This has been a special report. I'm Lila Lazarus.